out there, and welcome to another podcast session brought to you by Dr Ayorinde Foundation. So we've been having a series on cancer care. We focus on in Nigeria, and today we are going to be having another interesting topic. Yes, we're talking about cervical cancer. Anyways, this session is brought to you by the Dr Ayorinde Foundation with the support from Aspire Coronation Trust Foundation. And today we have with me your host, Dr. Ayorinde. We have Dr. Ayorinde Folasire. He is a consultant radiation and clinical oncologist in the University College Hospital Ibadan. You're welcome, sir.
Thank you, doctors. Thank you, viewers.
Okay, yes, we'll be talking about cervical cancer today. We know this is for women, and men are supporting women.
Yes, we are.
Okay, so what is cervical cancer all about? Like, it's one of the very dreadful cancer types. So can you just give us like a background to it?
Well, cervical cancer, like you have said, occurs in women, and is in this environment is the second leading cause cancer in women. So it's a cancer that occurs at the tip of women genitalia, the what we call the cervix, the mouth of the womb. So that is where this cancer occurs, and it's called cervical cancer.
Okay, thank you, sir. So it occurs at the tip or the mouth of the womb. Oh, that means the very personal one that people can really hide.
Yes, it is.
Okay.
It's not exposed. It's usually at the tip of the womb.
Okay, sir. So, like, what are the risk factors associated with this? Because looking at it, that is a very private organ. So, what can actually make women exposed or like susceptible to this form of cancer?
Yes, thank you. We have the factor that's what we call human papilloma virus. Is a major cause of cervical cancer. This human papilloma virus, when it infects it's a transmissible disease that's when it is transmitted to a woman, can then cause the woman to develop what we call cervical cancer. But there are other factors, only that human papilloma virus takes about almost 95 to 98% of the cause. But there are other factors which is deal with lifestyle. One, if a woman has early sexual intercourse, it can cause cervical cancer. Also, women with multiple partners or their male counterpart having multiple partners. All these that I'm talking about are all related to the human papilloma virus. Because if you have a woman that has multiple sexual partners, can get infected from any of those men. Or if it is a man that has multiple sexual partners, can get infected from multiple sex people, and then it can transmit to the woman. So they are all interrelated. So the lifestyle, which is multiple sexual partner, multiple, either a male or female, then any sexual intercourse, people with sex workers also have a high risk of exposure. People that have HIV, they also have high risk of infection, of development of cervical cancer. So basically, people that smoke, people that drinks, that shows that they have ability to have their sexual intercourse. I mean, they can be, they have a very high risk of contacting HPV, which is a major cause of cervical cancer. So those are the risk factors.
Oh, thank you, sir. Talking about the fact that HPV is a major factor.
Yes.
So now, like, how can we prevent HPV aside from screening or watching, like screening your sexual partner? Is there like a vaccine or a way whereby people can actually not get HPV?
Well, there are factors you can protect by having protected sexual activity. Also, not getting to have sexual intercourse at any stage. Like I said, multiple sexual partner, being faithful to your partner. Those are preventive methods. Then now to screening and vaccine. Yes, one needs to be screened to know if they have the virus that we have talked about, human papilloma virus. So if that person is negative to the virus, that is, you don't have that virus in your system, then such people needs to be vaccinated. And so that is why we are advocating that part of the immunization for children now, from age 6, 8, before they start their sexual activity, should be vaccinated with vaccines to prevent them from human papilloma virus. And so those vaccines are available now, even though they are not readily available, but they are now available for people that cares to get it. You can vaccinate both the male and the female counterpart. But the emphasis for now is still made on the female counterpart. But I feel once you either immunize the male, there's no way to transmit it. And if you immunize the female, also the transmission cannot continue. So both male and female needs to be vaccinated, but the emphasis more on the female counterpart now.
Okay, sir. Thank you, sir. Is there like an age limit for taking this vaccine? You said from 6 years old, so like till what age? Till
let's say till about 40, 45 can be immunized, because once you screen and the person has no HPV vaccine, HPV, human papilloma virus in their system, then you can receive the immunization.
All right, sir. Thank you so much. So, this program is brought to you by the Ayorinde Foundation with support from Aspire Nation Trust Foundation. So now, we've spoken about HPV a lot. So, I want to believe that cervical cancer screening is different, or is it the same thing? Like when people want to screen for cervical cancer, what kind of screening do they go for?
Okay, the main screening that we do for cervical cancer now is what we call pap smear. Okay, so we do pap smear screening. HPV screening is also part of the screening. So once you do HPV screening and you are not positive, then you take the vaccine. Otherwise, you also do pap smear. Pap smear is also a simple procedure that is done. It's just to scrape a little part of the tip of the womb that I said, and then look at it on that slide to be sure that it has no degenerative changes, or it does not develop into cancer. So once you do that, it's done once in 3 years. If the one you do is normal, then the next one will be in another 3 years. And it's recommended for every female that is of sexual age once you are having regular sexual intercourse, you have to do your pap smear regularly, every once 2 in 3 years.
Okay, thank you
2
so
to
much.
3 years. Yes.
That's that. So can you tell us symptoms for people maybe they don't do regular screening? Like what symptoms can women see and know that they need to run to the hospital?
Yes, the symptoms and signs for cervical cancer is when it depends on the stage of that woman, the age, because it can happen when that person is still menstruating or when the person has stopped menstruating. So it's cut across, even up to age 65, when someone has stopped even menstruating. So what do they see? Is to either see when you have sexual intercourse and you are seeing blood, post-coital, we call it post-coital, when you have sexual intercourse and then the person sees blood after, it shows that that person needs to be screened and tested to be sure that you don't have cervical cancer. Or when you have intermenstrual bleeding, usually ladies or women menstruate either 28 to 30 days. So you have your menstruation and before the next 30 days you menstruate again, and on the normal day it comes again, so it shows that there's a problem. It needs to see a doctor. Then, like I said, those that have finished or that have stopped menstruating, and you now suddenly, someone has menstruated last maybe 15, 20 years, and suddenly it started seeing blood, it is not menstruation, that woman has a problem. There's likelihood to be a cervical cancer. Again, some will not bleed. Some will start having vaginal discharge, offensive vaginal discharge, foul smelling, shows that there's a problem, and so that person needs to see a doctor. Those are the signs and symptoms of cervical cancer.
Okay, thank you so much, sir, for that. And lastly, we'll be talking about the management and treatment options for people that are already diagnosed. So what are the options available, especially for people in Nigeria, and where can they go for care?
Like I've repeatedly said, we need to detect all these diseases as early as possible. It is curable if it is found early. And so for early cervical cancer, the treatment options are also surgery and possibly sometimes radiotherapy, depending on the option of the patient. So surgery can be total removal of the womb itself, and then it can also be a partial removal of the affected part of the womb. That is as per surgery for early disease. Then also, if you don't want to still remove the womb, you can have radiotherapy, both brachytherapy and external treatment, and then that will be off. Then for advanced disease, it is basically radiotherapy. Surgery cannot be done at that stage if it is advanced, and so it's just radiotherapy and chemotherapy. So those are the options, and they are available most places that an oncology is in Nigeria. Thank you.
Thank you so much for that. We've learned a lot about cervical cancer. Thank you, Dr. Ayorinde Folasire, and I remain Dorcas Famoyebo. This session is brought to you by the Foundation with support from Aspirant Coronation Trust Foundation. And if you have questions, you want to make clarifications, you can message us, or you can reach out to us on 008 777 9043. And you can also send us an email, info@dove-avon.foundation.com. Thank you and have a wonderful day.
Thank you.